So can you hear me? Yeah, lovely. Okay, well, yeah, as Freddie was just saying, this is our third presentation. Welcome, everybody. First Thursday, which has been a tradition in the college for some time, which had kind of disappeared for a while. Amanda's resurrected it, so we're running with the ball at the moment and presenting on what we're calling advanced communication skills. Myself, retired GP, Naveed, practicing, very busy GP, and Freddie from the world of hypnotherapy. So what we're essentially looking at how the knowledge that we've gained through hypnosis can be applied, particularly from our point of view, the context of the 10-minute GP consultation, but clearly relevant to any sort of consultation with people where the aim is to help them. First session, as Freddie said, we covered chronic pain. A month ago, we looked at chronic fatigue syndrome and other medically unexplained phenomena. So tonight I'm going to be setting the scene on the topic of stress, anxiety, panic, phobia for a few minutes. Then Freddie's going to describe his approach and do a demo. And hopefully, if we get through, there'll be time for some discussion and chat at the end. Naveed is going to be keeping an eye on continuity in the chat box. So if you've got things you'd like to ask about or questions to raise or anything, kind of ask you that you put them into the chat box, and Naveed will be keeping an eye, and we'll try, and if there's some time at the end, to organise some way of looking at those. As I say, our common ground is hypnosis, and we're really looking at how the principles that we use and practice in a hypnotic practice can be used effectively in a conversational way in any sort of consultation. Point is that we cannot not communicate, and the challenge essentially is optimizing communication. Stress and anxiety particularly relevant in these times of COVID, I think. What I'd invite you to do is one of the communication skills is asking better questions, and what I'd invite you all to do is to suspend your critical faculties for the next hour or so and ask yourself the question whether what we're saying and what we're sharing and imparting is useful, rather than necessarily whether it's true or not. We've got an audience from many different backgrounds here, so what I'm going to do is just set a brief account of what we're talking about in anxiety in that field, and some of the theoretical models that we might use in helping people who approach us with difficulties in this area. Starting with some definitions, stress is, as a lot of psychological medicine, the terms we use are metaphors that are borrowed from the physical sciences, and stress is an example of that. It comes from engineering, essentially, or from physics. It simply is the application of a force to a system, and strain is the effect of this force on the system. So in psychological terms, we use this metaphor, particularly when we talk about pathological stress. It describes what we feel when our coping mechanisms are overwhelmed, and it occurs essentially when needs are not being met. A basic approach to our neurology, the primitive brain, the reptilian and the mammalian brain, designed around three basic needs. These are safety, satisfaction, and connection. So there's the safety is the hunted, the fight, flight, sympathetic nervous system orienting response. The satisfaction is the hunter going out and catching the prey. And then the connection, getting back into the cave, the rest, digest, the parasympathetic nervous system, the relaxation response. Polyvagal theory, modern way of looking at that now. So all these are dealt with pre-consciously. All this happens before our thinking mind, the neocortex, the third part of that model, comes into play. Your brain works faster than you think, essentially. It has to for safety's sake. If it doesn't get you out of danger, then you lunge before you've had a time to think about the lion that's jumping at you. So when the cognitive system, the neocortex, comes into play, we can start looking at what these needs are. And essentially, in cognitive terms, there's certainty, information, and control, or a sense of control, the illusion of control, which gives us safety. And if we don't have certainty, if we don't have the necessary information, if we don't feel that we have some control, then we experience this as stress. And the relevant parts of the nervous system, the amygdala, which is the security system, and the limbic system, and the hippocampus, the memory, these are triggered by whatever's happening in our experience, and they fire off this defensive pattern of fight and flight if what's perceived is perceived as dangerous. And this is felt as anxiety, which is simply defined as a feeling of apprehension or tension caused by anticipating an external or internal danger. So it's essentially future focused. Anxiety is emotion for the future. It's felt in the present, but it's in anticipation of something unpleasant, a fear invoking experience happening in the future. Varieties we talk about in medical practice are generalized or free floating anxiety, which is a diffuse, unfocused, objectless belief around the future. There's phobic anxiety. We talk about phobias, which are persistent, irrational fear of an activity, an object, or a situation leading to avoidance. The fear is out of proportion to any danger that there might be, cannot be reasoned away, and it's out of voluntary control. All this stuff happens pre-consciously. Then we come to panic, which is acute, episodic, intense episodes of anxiety with or without physiological symptoms. They're all basically responses or manifestations of fear, which is essentially anxiety caused by a recognized, specific, or observable danger. And this is a learned response. The teaching goes that we're born with only 2 fears, which are loud noises and heights, and the rest have to be learned. Some are learned easier than others, so it's much easier to make someone afraid of things that don't seem terribly familiar, like lizards or spiders or whatever. So there are some things that it's easier to become frightened of than others. Another distinction that's worth making in this discussion is that anxious people can get quite angry, or can get angry as part of their anxiety. Fear is a more profound emotion, and when people are afraid, they don't have the luxury of being angry. They're just too busy trying to survive. So really summarizing that, anxiety is an emotion. It's something, emotion, E coming out of motion. It's movement from within us, and we feel anxious. It's a feeling. As we discussed those in the earlier groups, it's somatic awareness. The body keeps the score. We say we feel angry, feel anxious. We don't say we think anxious. It's very much a feeling, as well as the somatosensory manifestations, the bodily sensations. There's emotional representation. The autonomic nervous system kicks in, heart rate goes up, sweating, etc. And there's the cognitive bit, the thoughts that we have that describe how we're feeling. And anxiety is used in 2 different contexts. Essentially, there's a state, so the current situation of being, feeling, experiencing anxiety in the moment. And there's also a personality type, there's sort of the anxiety-prone personality. So some people are much more prone to become anxious than others. So that's kind of the theoretical background. And then what to do? The first thing is always state. The most important thing in getting an outcome in anything that we're doing is our state. So we need a strategy to help build this. And the first and the basic building block that's common to all of us is the therapeutic relationship. And the primary duty of any therapist or interventionist is to provide presence, is to create the space, to hold the space where healing can take place. And this creates safety, a sense of safety, satisfying those primal needs. This connection. One thing that's common to all psychopathology is a sense of isolation. People suffer on their own. Being any sort of psychological distress is very isolating. So one of the main duties is to provide connection. And then empathy, feeling the same, getting on the same wavelength, but then moving. Pure empathy doesn't help, because it just opens up pain pathways, and if we just collapse into the patient's experience, we're not going to help them. So we need to feel empathic, but then that needs to move on to compassion, which is this combination of sadness and feeling their pain, and also kindness, and also wanting to do something to help. So it's very motivating. And we need to calibrate, and we need to be responding to the feedback that the patient is giving us, the client's giving us all the time. And this way the patient learns to trust the therapist, and this allows hope to build. And then from this comes expectation, which then leads to motivation. The interesting thing, just as 3 hypnotists talking to you, is that there are a lot of scales to measure people's hypnotizability. And the interesting, the research shows that hypnotizability, the patients, how they score on hypnotizability scales really doesn't matter at all in terms of outcome. People who are low hypnotizables do just as well with hypnotic interventions as highly hypnotizable ones. But it's interesting that the highly hypnotizable ones are far more prone to develop panic and phobic disorders. So the rationale for using hypnosis and hypnotic language, I've already touched on. The people who get the more extreme forms of anxiety disorders are highly hypnotizable, as far as the research evidence goes. Symptoms always have a positive intention, so it's part of the therapist's job is to help themselves and for the patient to become curious about what's going on. And essentially, people think that they are ill or in danger. It's thought. They think they're in danger, they're not. So this is what's known as trance logic. There are 2 contradictory realities existing in the same space. There's someone who's experiencing fear and anxiety, but there's nothing in their immediate environment that is precipitating it. And they express it as if you ask them if they're anxious, they say that, well, they think so, or they feel so. And this is something we can use, because when someone says, I think so, it means that they're not sure. So they're desperately looking for confirmatory supportive evidence, and our job is to help them to put their focus somewhere helpful where they can actually start to build and learn. to sort of help look for resources and build desired outcomes rather than focus on what may or may not be wrong. Essentially, they've either hypnotized themselves or they've been hypnotized by someone or something else. And what they need is dehypnotizing, basically installing a better response to the trigger. So when the old trigger comes along, a better, updated and more adaptive response is fired. And this change that they're looking for happens at a level of belief. They believe they're in danger. And belief is a feeling of certainty about a thought. Again, back to the body keeping the score. Nothing is learned until it's felt in the bone. They need to feel that they're safe and feel that there's something going on. So it's our job as therapists, as interventionists, to be curious. This is interesting. Something in this person is waking up. At some level, it makes sense, and welcoming it and finding it a space where the obstacle can then be transformed. So as I say, getting the state right, getting our state right, and helping them get their state right is crucial to the outcome. Providing resources, safety, nurturing, self-compassion, wisdom. They have this already. We just need to help them to find access to it. And essentially breaking neuromuscular lock. The body is holding it, and until you can get them to relax and let the lock go, no healing will ever occur while there's neuromuscular lock. So until you can laugh at yourself, until we can laugh at ourselves compassionately, we can't change. So the first milestone is to resource people and to get this relaxation response going. They need to be sick and tired of being sick and tired, and then they can change. And this is what takes the time. So if you remember the cave at the beginning of it, there's this rest and digest, this most basic instinct, this familiarity. And if change is difficult, this is why. Because although how awful it might be, it's familiar and it can be hard to shake. And the point is that change is instant, and it happens the moment and a better alternative comes along. And this happens at the level of belief. So essentially getting state right, some emotional down regulation, numerous ways of doing it. Freddie's going to give you a demonstration in a while of how we might do it or how he does it very effectively in a hypnotic context. And then developing an attitude of responsibility for our own outcomes and creative curiosity. I say this is all the stuff that takes time. And Socrates, so when the student's ready, the teacher appears. So the trick is to identify the triggers, get people into the right state, identify what the triggers are as accurately as you can. Again, this is crucial. And then install a better response on the triggers so that when the triggers come along, the better, more desired response comes rather than the old anxiety-based response. And then to test it to make sure it works, and so that they know it works as well. So I think that's enough for me. Time for Freddie to get on, and rather than talking the talk, time for somebody to walk the walk for you.
Well, good evening, everybody. Thanks, Mark, for that explanation and of how we develop a fear and anxiety. As Mark said, the theory is that we're only born with two fears: the fear of loud noises and the fear of falling. And I don't know if you do it now, but in the old days, maybe when I was born, a midwife, to see if a baby's brain functioning was okay, they would do this with a baby, and it would do the Klingon response. That goes way back, I suppose, to when we were hanging on to our mothers' backs. So that was the first response. They'd lay the baby in a cot and they'd do that, and they'd do the startle response. And if those two things were working in a baby, it was pretty much the brain's functioning properly. So those two things we're hardwired with. We're born with those two fears. Everything else is learned. Now, many irrational fears, and I'm including some anxiety and general anxiety in that, is learned. We're not born with those anxieties, but this is the way our kind of brain works. And my simplistic way of explaining this, it starts with our imagination. So let's say you're a child and your mother's got a fear of wasps. And every time a wasp is nearby, you see your mother kind of flapping about and panicking. You've not been stung by a wasp at this point, but you see your mother afraid of a wasp. So your imagination runs. You see the wasp and you imagine it hurting you. And so at this point, it's your imagination, because you haven't been stung by a wasp, you haven't been hurt. If you were asked that child, has that wasp ever hurt you? No, well, I can imagine it can hurt me because my mum's scared. Then what happens after that? The next step is that imagination becomes automatic. I see a wasp and I feel anxious. That's just a physiological response to seeing it, because now our imagination become automatic. But the next stage of that is that we forget we're only imagining. Now, if you forget you're imagining something, to your mind and your body, it seems real. That's why when I watch Star is Born, I can cry. I know it's actors, And I know it's on the TV, but I can get teared up because I suspend my imagination for a moment. So the moment we forget we're imagining, then it appears to be real. So some years ago, and some of you, the doctors here, might know this bit of research. They did this bit of research where they put this guy into a HMRI scanner where they could see what the activity of the man's brain. And then they gave him a simple task. And the task was this: to press a button in his right hand or his left hand randomly. Whenever he wanted to press the button, just press it. And so that was his task. And they were monitoring his brain. But after 5 or 10 minutes of monitoring this guy's brain, they could predict which thumb he was going to press before he pressed it. And sometimes that was several seconds before he pressed his thumb, even though he thought he was pressing it as he thought about it. But what they found from this was the decision to press his thumb had already been made out of conscious awareness. So what came from this bit of research and what it meant for me as a therapist is this: we can't do anything without our brain running what's known as a schema for it. So if you've got a cup in front of you or a pen in front of you and I ask you to pick that pen or that cup up, you could do that easily. But to build a robot to do that one simple task would be immense. You'd have to have the best mechanics, the best computer people, the best people in the world to build a robot to pick that cup up, pour something into its mouth and put it back down without spilling it or crushing the cup. It would take the best mechanics on the planet. But the moment I say, can you pick that cup up, your brain would figure out everything you need to do before you move a muscle. The whole plan of what you need to do will be figured out before you even move a muscle. So what this means to me is this: we can't do anything. Pick up a cup, present to people, meet someone for the first time. We can't do anything without running to an outcome. Our brain will run to the outcome. It will figure out everything we need to do to get that outcome. You know, I present all around the world and I present to hundreds of people at a time. And there might have been a time in my past where I might have been anxious about that, as most people are when they do public speaking. What if I trip up the step? What if I go red? What if I forget my words? What if I drop my papers, or whatever it might be? All the things that go through someone's head when they step up to present. Now, that's what normal people do. I'm not saying I'm not normal, but that's what normal people do. They kind of look at the worst case scenario. And of course, if you're looking at the worst case scenario, as Mark was saying, we're geared for survival. We don't want to feel embarrassed. We don't want to feel pain. We don't want to feel any of those things. And so we figure that out. But once we recognize, and this is what I'm going to say to all of you now, once you recognize that if you're feeling anxious about a future event or a future action, at this point in time, and this moment in time, it's just your imagination. It's not real. It's just not real. I'm going to say something very strange to you. Nothing's real. You'll say, well, that's ridiculous. I'm looking at my computer. Of course it's real. My cup's real. That's not what I mean. What I mean by that is when we think about our past, it's not exactly as it was because our memory is not 100%. In fact, all memory is constructed. We think about our past, things we could have done, should have done, would have done if we'd been felt differently. And we can feel anxious about that. They say if you're worrying about a past event, you're depressed. If you're worrying about the future, you're anxious. So when we think about our past, it's not real. In fact, the past is a void. It's a vacuum that stretches back to the Big Bang. It doesn't exist. When we think about our future, it hasn't happened yet. It can only be imagined. So that's not real either. So the only thing that's actually real is right here in this moment. And by the time I've said it, it's already passed. So I'm going to demonstrate something. Anyone here that's got some kind of anxiety about something that's coming up in the future? Anyone? Rachel, do you want to do this? Okay. I'm going to pin you to the screen, Rachel, if that's all right. It's not as painful as it sounds, trust me. Just going to pin you to the screen if I can do that. Let me have a look. Right, can everyone see Rachel? Okay. Well, if not, you can just, let me just do something else then, do it a different way. No, I can do this now. But you can all, if you look, there's a 3 little dots at the corner, blue dots. If you want to pin Rachel to the screen, if you'd rather see me, that's fine. I'll see everybody else, that's fine. Okay, Rachel. So you've got something you're feeling anxious about in the future, yeah? Switch his mic on. Can you switch your mic on?
Yeah, you hear me?
Okay.
Okay.
Right. So, you know what I've just said to you about how when we're thinking about the future, it's only our imagination, yeah? I want you to do this for me. Place your hands together like this. Put your hands up where you can see them. And squeeze your palms together. At the same time squeezing your palms together, pull your index fingers 1 inch apart like that. Look at the gap between those fingers, Rachel, because in a moment they're going to come together and touch. Look at the gap between those fingers. As you listen to my voice, feel those fingers being pulled together. In a moment they're going to touch. When they touch, close your eyes. Close your eyes now. That's right. Feel that force. Close your eyes. Think about the people you love and see those faces. Feel that love. And as you feel that love, every irrational fear and anxiety disappears from your body and your mind. And as you feel that love, those hands are sticking tighter and tighter together. They're super glued, bolted together, they're stuck. Imagine they're carved out of a single piece of wood. And when you realize they're stuck and there's nothing you can do about it, I want you to try and pull them apart and find you cannot. Pull even harder, find a stick even tighter, Rachel. Imagine there's nothing you can do about that. That's right, it's funny. And it's going to seem even funnier when you look at those hands. That's right, you can probably laugh out loud. I'm going to click my fingers and your hands will come unstuck and you'll feel incredible. That's right, hands coming unstuck. Okay, right, you know when I asked you about the anxiety you're feeling, on a scale of 1 to 10, how anxious were you feeling about that in the future?
8.
8? Okay, do this again. Place your hands together again like this. Squeeze them tight, pull your fingers 1 inch apart. Look at the gap between those fingers. In a moment they will touch. When they touch, your eyes will close. Look at that gap. Feel that force, put them together. Look at your gap, not mine. That's right. Close your eyes. That's right. And imagine they're sticking tighter than before now. They're super glued and they're bolted together. Really use your imagination. Imagine there's nothing you can do about it. When you realize there's nothing you can do about it, try and pull them apart. Find a stick even tighter now. Now, I'm going to remind you that that anxiety you had started with your imagination, Rachel. I'm going to remind you of something else. I only ever asked you to imagine that your hands were stuck. I only ever asked you to imagine they were glued. And anytime you want to stop imagining it, just stop imagining your hands are glued and see what happens. Okay, excellent. I want you to do this for me now, Rachel. I'm going to remind you that anxiety you were feeling was only ever your imagination. And I want you to do this. Let go of your hands for now. Let go of your hands. You can let go of them. I want you to do this. I want you to just stop that imagination you were thinking about in the future. Just stop imagining it. Do it now. And when you've done it, when you've stopped imagining that thing that was making you anxious, just nod your head so I understand. Okay, I want you to think about that thing now and try and feel that anxiety. On a scale of 1 to 10, where's the anxiety gone now? Try and feel it and find you cannot.
I can't.
Where's it gone now? Where's it gone? You can't feel it. And I'll tell you why. It was never real in the first place, Rachel. Thanks for doing the demo for me.
Hey, thank you. That's really helpful.
Right, I'm just going to remove the pin. Again, it won't be very painful. There you go. Right, so look, I don't know if you can see me on the screen now, but yeah, is Rachel still on the screen? I'd like to get myself back up if I can.
Shall I reboot myself?
That's all right. No, yeah, you can mute yourself if you want. Okay, look. I don't know how long that's taking. These whole lectures are about being able to help GPs help someone overcome something in a 5 or 10 minute GP appointment. Most GPs, when you talk about hypnotherapy, they say, I can't do it because I haven't got time to do a 20-minute induction. I haven't got 20 minutes to relax somebody. You've just seen now how you can eliminate that. That's right, you're laughing because it's funny. That Rachel's anxiety went from an 8 to a 0. If we just briefly explain to our clients or our patients how anxiety or how fear develops, and then just say it starts your imagination. Let me show you something interesting. At no point did I say I'm going to hypnotize Rachel. At no point you felt like you were hypnotized, did you, Rachel? No. So you say, I'm going to show you something interesting, the power of your imagination. And then you do a simple finger lock, utilizing emotion. And then you say, you symptom scale it on a scale of 1 to 10. How's that? How anxious are you? And then you say, I'm going to remind you that I never asked you to imagine your fingers were stuck. Anytime you want to stop imagining it, see what happens. Now I'm going to remind you that fear and anxiety you're feeling, I never started with your imagination. Anytime you want to stop imagining it, just stop imagining that that thing you were fearing was dangerous or anything else. And when you've done that, nod your head. Okay, on a scale of 1 to 10, where's the fear gone now? It takes as long as I've just explained it to you. We can look into this and we can figure out how the brain works, and it's incredible. I was saying to Mark earlier, the amount of knowledge that Mark has. Look at the books behind him, all those things that he's read over the years. This brain is incredible, and it does. But for me, because I am not a scientist, we can change anxiety, we can change fear very, very rapidly. We can eliminate pain in minutes. That's how our brain works. Let me tell you something else. Nothing exists outside of your skull except its perception. Nothing. You're all looking at me. I don't know, 50 people looking at me. You could probably describe me to the person sitting next to you, or the next square to you on this screen. You could probably describe me. But if Heather, for one moment, had Naveed's perception, if she could see what Naveed is seeing when he looks at me, it would be so vastly different to what you're seeing, Heather. It would be psychedelic. Yet we think we're looking at the same thing. We think but it's not, it's perception. Even pain doesn't exist outside of your skull. You could, someone, and I know it's a warning sign, and we know it allows us to feel and avoid pain and avoid injury. But if you were to break your neck and sever your spinal cord at your neck, you could take your leg off and you would not feel it, because it registers in your brain, not in your leg. So what I'm saying to you here is, when it comes to anxiety, we can look at this very simply. If you've got a friend, I want you to try this, because it's going to happen over the next few days. Someone's going to say to you, I'm feeling really anxious about this. You could just say to them, imagine it differently. Just imagine it differently, or stop imagining it. Because at this point in time, it's not real. Just imagine that we could change our mind that simply. Once we recognize that whatever we're thinking about, whatever we're worrying about, whatever we're anxious about, is just at this moment, before we move, it's just our imagination. It's not real. I have a friend, he suffers from OCD. He's a brilliant card magician. He's probably the best card magician in the UK. And it partly is because he's OCD. He'll spend 6 hours a day working on a trick. He's fantastic. But the other side of that is he has a fear of germs. And when it bites on him, when this fear comes in, he's 6'1", he'll go down to like 7.5 stone. He won't eat anything unless he's cooked it and seen where it's come from. But he knows. And the thing about this, as Mark was saying, that highly suggestible people are the people that suffer the most from anxiety and fear. Because let's say I'm going to go on a flight. If we think about it too much, we're going to be 30,000 feet in the air in something that weighs kind of 200 tons or something. How does that happen with all those people? How do they get that up? How is it staying in the air? If we think about it too much, we'll all panic. But my imagination is not very good. So I don't think about it too much. I can't imagine it. But someone who's got a great imagination and they've got a fear of flying, they will visualize that plane bursting into flames and flying through the air in the sea and killing themselves. They will visualize that because they've got good imaginations. And it's kind of a double-edged sword. The people who are most anxious, the people who have the most fear and anxiety are the most susceptible hypnotic subjects, if you like. So we can utilize that. If you've got a good imagination and you're running it on a worst case scenario, of course you're going to feel that fear, because your brain and your body are completely connected. You can't think something without it affecting your body. Let me demonstrate this with somebody. Who wants to have a little demonstration, the power of the mind over your body? Put your hand up. If someone see who's putting their hand up. Anyone? Caroline? Yeah, are you up for doing this?
Yep.
It's going to pin to the screen. I'm going to make a spotlight for everyone, actually.
Okay.
Okay. Right. Has that worked, by the way? Did that work?
No.
No.
Yeah.
Okay. All right. Okay. Well, anyway, I'm not sure if I have or not, but let me see.
Yep, you have.
Here you are. Okay, great. I want you to do this. So I'm going to ask you a question, a simple question. Who are the most important people in your life? Who do you love most?
My family.
Okay. So I want you to do this for me, just to show you the power of the mind. I just want you to put your right arm out in front of you like this. And everyone see Caroline, by the way, nod if you can, yeah? Yeah, put your arm out like this. And I want you to think about your family. I want you to think about the people you love. And I want you to see those faces. And I want you to feel that love. And I want you to understand just how loved you are. As you feel that love, Caroline, as you see those faces, I want you to notice that hand is hanging there all by itself. Imagine there's nothing you can do about that. And when you realize there's nothing you can do about it, I want you to try and get it down and find it goes even higher. And I do not want you to pretend, Caroline, feel that force pulling it up. You're a strong woman, push even harder, find it goes even higher now. An incredible force pulling up toward the ceiling now. That's right, you can feel it. See those faces, feel that love and feel that pull around that hand, pulling it up. That's right. You're a strong woman, but your unconscious mind is a superpower. Close your eyes, see those faces. As you do that, that hand's going to drift up toward the ceiling all by itself. And it will be an incredible experience for you. Feel that force pulling it up. But are you hypnotized? Are you in a trance? Why can't you get your arm down, Caroline? That's right, feel that force now. I'm going to click my finger. Your arm will drift down. Your eyes will open. You'll have a smile on your face and a totally new understanding of just how loved you are. Get ready. Okay, excellent. Thanks for doing that for me, Caroline. Okay, so when it comes to our imagination, the power of our imagination over our body is immense. We can't imagine something without it affecting us physically. We can't experience physical pain without affecting us psychologically. It's just the way it is. So when it comes to anxiety, as Mark was saying, and I'm not going to get into the science of it because I don't know it, but it's a simple explanation for me. As I said, we're only born with two fears, fear of falling and fear of loud noises. Everything else is learned. And so, like with everything we learn, once it's become an unconscious ability or skill, something we do without thinking, we no longer have conscious control over it. It'll be for someone who's suffering from anxiety or stress, for you to just say, get over it, would be like you saying to them, forget how to talk, forget how to walk. They say, well, that's ridiculous. It's no longer something that I think about. It's something that just happens. I see people who smoke 30 cigarettes a day for 30 years, every single day. I say it's an incredible feat. To try and remember to do something 30 times a day, every single day for 30 years without fail, that's an incredible feat. You couldn't do that consciously. At some point, probably as a kid, 11, 12, 13 years old, they said, this is really important. Remind me to have a cigarette every hour. And the moment they hand that job over, they create that process, they no longer have to think about a cigarette. They get a cup of tea, it happens. And that's works with all of the things you've learned to do: driving, walking, talking, reading, writing, riding a bike, swimming. Think about the incredible things you've learned to do that are now just an automatic function. Imagine if you had to think about walking all day. I've got to put this foot here, that foot there, I've got to balance. If you've got young kids who are just learning to walk, watch them. You know, it's a tough thing to learn to walk, to balance. And we learn it, and then it just becomes automatic. If you had to think about walking, our head would be so full of walking, wouldn't really think about anything else. And that ability to learn complex things and then allow them to become something becomes automatic is incredible. It allows us to function at the level we function as human beings. Where it works against us is when we learn an irrational fear or anxiety. As I said, we learn it through our imagination. There's that way, like we would learn to read or write, we learn it by rote. But we have these two sets of nerves running through our extremities. If you were to put 4 or 5 different objects in your pocket, say you put a screw, a pencil, a coin, whatever it might be, and you put your hand in your pocket, you could pretty much determine which thing was which. Through your fingertips, you have those senses. It will go through there and it will go to your brain and you'll figure out what that object is. And that's one set of nerves that run through. They all pass through the amygdala that Mark was talking about, and then you'll figure it out. But there's another set of nerves, and that is the one, if you put your hand in your pocket and there was a screw in your pocket and you jab the end of your finger, you just pull your hand out. You wouldn't think, yeah, that really hurts. I'm going to pull my hand out of my pocket. It bypasses your ability to think. It just does it. If you touch something's hot, you don't have to touch it 5 times to think that really hurts. You touch the object, you feel the pain, the amygdala fires off, takes a snapshot of that object, and then for the rest of your life is scanning the environment for anything that looks like that so you don't get burned again. It's like a one-stop learning. And once it's learned, it's just there. It's a process, it's a program. You can change it through hypnosis, you can change it through other methods, but it's a piece of programming, but it's a one-stop learning. And you can deal with these programming. That's how I see hypnosis. It gives the operator, the hypnotherapist, the hypnotist access to that underlying programming. So the client, the patient, can change that program. And if it's an irrational fear or anxiety, then the brain, for whatever reason, goes, okay, we can turn this off. We don't need it. And that's how quickly you can change an anxiety. Seriously, you can do it. And I know some of you are going to do it. If you've got a kid that's anxious about their exams, well, when you think about it, what's happening? Well, I think I'm going to fail, and I think I'm going to forget what I'm saying. Well, imagine it differently. Imagine that you can do it. Because either way, it's not real. I've got a son. My oldest boy is 50 this year. He lives in Kent, and he's been working. He's got his own building construction business. He works with specialist glass partition, these banks and top hotels and stuff. And he's done it since he was like 18. He's got a great business, he's got men working for him. And he spoke to me a couple of years ago now. And he said, Mel, that's his wife. He said, we've discussed it. He said, and we've worked out, if I just tweak my mortgage, I can pay my mortgage off by the time I'm 50. So, and bear in mind, he's in his 40s when he's saying it. And he lives in Tunbridge Wells, so he lives in a really nice house, right? So he said, I can pay my mortgage off till I'm 50. In the very next breath, he said to me but then what if in the next 10 years, the people I subcontract off decide not to use subcontractors? What happens then? I said, well, when was the last time you had a day out of work? He said, I've never been out of work. I said, how long have you been subcontracting on this company? He went, 20 years. I said, well, why in the next 10 years would they decide not to use you? I said, you can imagine that and carry on paying your mortgage till you're 65, or you can imagine paying your mortgage off at 50 and living in £1 million house with no mortgage. Which one of those empower you? Because either way, it's not real. When I present now, this is what I think. I think they're all going to be friendly. They're going to love what I've got to say, and we're going to have a great time together. And that's how I enter into a presentation. I could worry about it. I could think you might all think I'm mad or whatever. And I would approach this in a completely different way. Either way, it's not real. I might as well imagine the best outcome. If we can explain this to our clients, to our patients, then even with illness, even with COVID, when people are worrying and they're anxious about COVID and they're worried about the outcome, which is totally normal. But we need to remind them that at this point in time, yes, you have to take precautions. You have to do the things that the doctors are saying and the science is saying. So we give ourselves the best chance to avoid it. But when it comes to worrying about it, you might as well imagine the best outcome. Providing you're doing everything you can, you might as well imagine the best outcome. Because either way, it's not real in this moment. Many of you are doctors here. And many of you already know the power of the mind over your body. It's been said that medication might not always be necessary, but belief in a recovery is. If someone doesn't think they're going to recover from their illness, they are not going to recover. It doesn't matter what the medics do. If you don't believe you're going to recover, you will not recover. And yet most of us spend our lives worrying about things that never happen. How much brain space have you taken up in your life worrying about stuff that never actually occurred in the end? How much time do we spend worrying about stuff? Once we recognize and remind ourselves that it's just our imagination, at this point in time, it's not real. We can take precautions to give ourselves the best chance. But then once we've done that, there is no point in worrying. My attitude towards it is there is a point of no return. Once I decide to do something and I'm committed to it, there's no point in worrying. You might as well go all in. I don't know if this is true or not, but I think if I was on a plane and the pilot said the engine has fallen off and the plane's going to crash, we've got 3 minutes, stick your head between your legs, I'd like to think I'd go, let's see who can keep our hands up the longest. I've only got 2 minutes left. I'm going to enjoy this last 2 minutes. What's the point in panicking and sticking your head between your legs and screaming your head off when there's no chance of recovery? Once we got to that point and we committed, then you might as well stop worrying. Whatever's going to happen with COVID, it's going to happen with COVID. And we can't do anything about it. But we can take precautions. We can keep our distance. We can wear our mask when we're out. We can keep our hands clean. We can do all the things that we need to do to give ourselves the best opportunity. And then stop worrying about it, because it's not real. But when it comes to our well-being, and I'm asking all of you to do it, if you're anxious about your physical well-being, once you're taking the precautions, taking the right nutrition, drinking the right water, doing the right exercise, doing everything you can to give your body the best opportunity to be well, then stop being anxious about the future, because it's not real. Do you understand this and how quickly we can change them? I want all of you to think about something that's making you anxious before we sat down today. Think about it right now. Now imagine it differently. Or stop imagining that. See what happens in your body and your mind. How many of you now cannot feel that anxiety? Yeah. This isn't rocket science, but it is, to my mind, more powerful than rocket science. We can give a brief explanation. I'm not a doctor, so I'm not going to get into all of those things. But my clients, if I meet someone at an airport and they cannot get on that plane, I have no doubt within 5 minutes I can get them on that plane without the anxiety. I have no doubt in my mind. We can spend hours and weeks and months going through flooding that they used to do in the old days, and desensitization takes forever. Or we can say, stop imagining it in that way. Imagine it differently. And what about if everything you're feeling anxious about at the moment, I'm talking about everything that you're worrying about in the future, you could say, okay, I'm going to imagine it differently. And change your life and change your mind. I believe we can do this for our patients. I believe the doctors here can do this for their patients in a 5-minute therapy session. You don't have to go into all the ins and outs of how the brain works. You just go into how imagination works on our body. All of you can do what I did today. It's a simple demonstration of the power of the mind. If you use emotion, This is going to happen. This is a physiological thing. If you put your fingers there long enough, they're going to pull together. That's like a playground trick. Kids can do it. If you look at it long enough, the tendons are going to tie and they're going to pull together. If you suggest, because remember, when your patients in your room, they're not in a normal state, not the same state they walk into the greengrocers in. They're in an altered state. You can utilize emotion. You can say, let me show you something. Let me show you something interesting. Not to say about hypnosis. You can give a brief explanation of how anxiety is created, how our brain runs that schema, that it always runs to the outcome, and it's always trying to protect you. That's why you're feeling anxious. But at this point in time, it's just your imagination. Let me show you something interesting. You can all do this if you want. Do it. Put your hands together like this. Put your hands up where you can see them. And squeeze your palms together. At the same time, squeezing your palms together, pull your index fingers an inch apart. Now look at the gap between those fingers and imagine they're magnets. And as you listen to my voice, you're going to feel them pulling together. In a moment, they will touch. When they touch, close your eyes. See the face of the people you love, people that love you. And feel that love right now. And as you feel that love, as you see those faces, those hands are sticking tighter and tighter together. They're super glued. They're bolted together. They're stuck. Imagine they're carved out of a single piece of wood. And when you realize your hands are stuck and there's nothing you can do about it, you can try and pull them apart, try to stick even tighter. I do not want you to pretend, pull even harder, try to stick even tighter. Imagine there's nothing you can do about that now. I'm going to click my fingers and your hands will come unstuck, your eyes will open, you'll have a new understanding about the power of your mind and the power of imagination. Excellent. And then you just give your patient, your client, an experience of that. And then you just say, teach them about the automatic imagination system. It starts with our imagination, then it becomes automatic, then we forget we're imagining it. At that point, it's real to our body and our mind. Then you do the same thing again. Stick their hands together, and then you say, I'm going to remind you, I never asked you to imagine your hands were stuck. Anytime you want to stop imagining it, see what happens. This will happen. And then you say, I'm going to remind you that anxiety you were feeling, I never started with your imagination. Anytime you want to stop imagining that, stop imagining it, see what happens, do it now. And when you've stopped imagining it, just nod your head. Now try and feel that fear and find you cannot. You can help somebody in moments, in minutes, with this simple explanation and technique, seriously. And I got this idea because my son's, he works on the college with me on our academy, teaching people how to do hypnotherapy. Years ago, he ran a session on automatic imagination. And I went back to my office the next day and I thought, how can I utilize this? Because he was doing it for street hypnosis and for entertainment. Then it occurred to me, I can explain this. So the lady came in and she had a fear of having blood taken. She didn't fear a dentist or doctors or hospitals or any of that thing, but it was just having the thought of having blood taken, she would panic. And I asked her and she said 4 years ago, she'd passed out with having blood taken. Since then, this fear and this phobia are created. She imagined she was going to pass out again. Listen to the words. I imagine I'm going to pass out again. I did this simple thing with her. And I said, now stop imagining that you're going to pass out. Stop imagining it's even dangerous having blood taken and see what happens. And she couldn't feel that fear again. And it took as long as it's taken me to explain to you. So I hope you've got an idea and maybe something you can take into your practice and try it. Be brave about this. The worst thing can happen is like Jacqueline, she went, that's fine. But out of 52 people, there's one person whose hands didn't feel like they were stuck. That's going to happen every now and again. Be unafraid and just do this and see what happens. You're going to change lots of lives and remind yourself when you are getting anxious about a future event, bring yourself back to remind yourself it's just your imagination. You probably know now, we've got 10 minutes and Naveed's going to come on and answer the question in a moment, but I'm going to leave you with something else because you probably understand now that I am not a normal therapist. I think slightly differently and I don't care about what people think. So I'm going to leave you with one thing, and you're going to be stuck with this, I promise you. And it's going to annoy you for a while, but it's just hard luck. In a moment, I'm going to sing to you. Right? This is a serious medical lecture, and I'm going to sing to you about that. And the thing about it is, anytime you start to feel anxious in the future, anytime you start to worry about a future event, unfortunately for you all, because I'm not a great singer, you're going to be stuck with this song in your head, and it will bring you back immediately to where you'll know you can do this. Okay, are you all ready? I know, I'm going to get booted off this lecture because I'm going to sing to you, but here we go. Bear in mind, if you don't want to listen to this, close your ears, because you are going to be stuck with it forever. The next time you start to feel anxious or afraid, you're going to hear my voice in your head singing this song. It's just my imagination running away with me. Just my imagination running away with me. And you're going to be stuck with that song in your head from now on. And you're going to bring yourself back and you're going to say, I can imagine this differently. Anyway, that's my bit for the day. And maybe they'll let me back to the next lecture after my singing. I promise you I won't sing to you again, all right? But anyway, that's my little bit for this evening. Think about it. Let go of your anxiety. Show other people how to. You can just do this in a sentence with someone. Someone is panicking or anxious. Say, it's just your imagination. Imagine it differently. I'll leave you with that thought. Back to you, Mark.
Lovely. Well, thanks very much, Freddie. Yeah, perhaps time to let Naveed have a run, see what's been coming up in the chat box. And anything there that we can be looking.
Just want to say a really big thank you to both Mark and Freddie for that wonderful session. They've shared so much information this evening. Just from the perspective of a practicing GP, I see, tens of hundreds of patients each week, each month. And most of you who are new to these techniques and new to this are probably thinking, how can I incorporate this into what I'm doing? Everything that we've shown you so far is all conversational. Everything can be incorporated into a normal conversation with a person. They don't even know what you're doing. You don't even know sometimes what you're doing until it's over and you think, oh, I've just run a pattern or I've just spoken to them in a particular way. But everything that we're doing is conversational. And having practiced these techniques for many, many years on my patients, I know myself when I speak to them, I don't even realize I'm doing it half the time. But what's interesting is the response you get at the other end. People often say, oh, I feel so much better having spoken to you, or oh, my anxiety is so much easier. And these simple techniques, I urge you all just to try and play with your patients, with your clients in your consultations. We've had lots and lots of chat going up and down this evening. One of the main ones, I've seen a few, Freddie's already mentioned this, a couple of people have said, oh, it hasn't worked for me, or I found this a bit difficult. To be honest, most people who find that, it's probably the anxiety of sitting here on a webinar with other people watching you. What I urge you to do is all the recordings from this evening and the other Thursday evening lectures that we've run through the College of Medicine are available on the College of Medicine YouTube channel, which will send you a link very shortly. And I urge you all to just go back, replay the video, watch the technique, listen to it a couple of times, and then just practice it yourself at home without anyone watching, and be surprised at how easy it is for it to work for you. And if it can work for you, imagine what it can do for your patients. So I'm going to open up the floor now. If anyone's got any questions for either Freddie or Mark or myself, please just, put your hands up or type in the chat. We've got about 5 minutes to go before the end of the session. So if there's any burning questions, please, now's the time to ask.
Perhaps while people are thinking, there is a question there which I'm trying to think of the best way to answer. Somebody's asked about what would our mindset be with a cancer diagnosis. Now, if I understand that to be how would we approach someone with a cancer diagnosis, it's highly likely, or it's almost inevitable, that that's going to have created some anxiety. So everything that we've said around how to manage an anxiety, what they think the future is going to be, is helping them to create some useful constructive beliefs around what the future is going to hold for them. There's obviously going to be challenges there, but there are also some opportunities as well. So I don't know if that answers the question, but I think it's an important question. I don't want it to be, I don't want the questioner to think it's being ignored. But it's those are just my thoughts. You know, we're not dealing in this area of medicine, and the attract and the beauty of hypnosis in my practice is what to do when you don't know what to do. You know, when the evidence base has been exhausted and people have had all the treatment and the therapy and everything that's available for whatever it is that medicine has worked out what's wrong with them, but still are diseased. You know, how can we help them then? And as Freya's saying, it's helping to use their imagination constructively to build, you know, what future they can with whatever hand they've been dealt. I don't know if that helps.
Well, you know, the thing is, again, if you're terminally ill, then you're obviously going to feel anxious. But you can relieve that anxiety. You can do things for that anxiety. You can help people overcome that, accept it, and then live the best they can live. And you can do that in conversation, explaining the same thing. I'm going to share something with you all. My granddaughter Beth, she's 27 now. She's been a girl that's played hockey for Kent and football for Kent. She's been a great girl. She went to grammar school and went to university studying Spanish and politics. As part of her course, she went to Spain. She went to my brother's place in Fuerteventura. She came back. She was driving. She'd never been in her life. And her mum was sitting beside her. Her brothers were in the back. And she pulled up and she had a fit. First time she ever been ill. Took her to the hospital and they diagnosed an arachnoid. So this is back 5-6 years ago, and there was no way of operating on this tumor because it was not just one lump tumor. It was into all the areas of her brain, and of course we're devastated. She's my first grandchild, and I've got 5, and her dad my son was devastated. I said to her, which really upset my son, I said, you might as well imagine the best outcome. They couldn't do anything. They were just going to monitor it every 6 months. They didn't know how long she'd had this tumor or what was going to happen. They just monitored it. And I said, look, you might as well imagine the best outcome, because either way, at this point in time, we don't know. It's hard to say that. My son said, it's not a chunk of ice, blah, blah, blah. He really had a go at me. Anyway, long story short, and I said, the other thing is that medical science comes on leaps and bounds. And last year in July, the 26th, she elected to have the operation. It was a 12-hour operation, and they removed the tumor. 5 years before, they couldn't do that. But and people think I'm really harsh because I'm imagining my granddaughter, even when she was first diagnosed, having a life, having her babies, getting married, all the things that you'd want for your granddaughter. Because the alternative was I would not be able to get up. I wouldn't be able to move. I wouldn't be able to go on my day if I was imagining the other outcome. And it's easy to do. But if I had done that, if I'd spent 5 years with anxiety about the outcome for her, the thing is not going to change. The outcome's the same. It's going to be the same. But I can spend that time worrying, or I can spend that time imagining the best outcome for her, and she can spend the best time. Everyone else, there's people around her panicking. She just went through that. She's a fantastic woman, and now she's through it. And I said, thanks to medical science and 3 of the best neurosurgeons in the world, she had that done. It's incredible. But you understand what I'm saying? We might as well, don't matter what the situation, might as well imagine the best outcome.
Can I say,
You muted.
Freddie? Oh, no, I'm not.
Yeah, we're nearly there. We're going to have to wrap up in a minute, but perhaps one more, and then I've just got 1 or 2 things I need to say before we finish, please.
I had a brain tumour in 2011 and woke up from surgery with a dead leg. And that's what my consultant said, I'm sorry, your leg's dead. And I immediately said, it's okay, it'll come back, wherever it came from.
Yeah.
And I mean, I had a stroke post-surgery and it came back. I'm here. Yeah,
great.
My last appointment, so 2 years ago, she was ready to do, I've got another tumour in the falx, which is inaccessible. It's a meningioma, it's, not an exciting tumour. But she was ready to do surgery and had suggested that before I came in. And as soon as I walked in, she said, but you're fine. So I said, yeah, I'm great, thank you. And I actually sat down and did havening techniques with my consultant to reduce her anxiety.
Her anxiety, yeah, great.
Her anxiety. And
Fantastic.
you know, it was about my perception is I'm fine.
Well, I mean, it's fantastic, and well done, Louise. You know, we're all of us nodding here. You're fantastic. Well done.
Yeah.
Okay, Mark, I know.
I have to wrap it up a bit. Yeah, just thank you all very much for attending. Trying to stick accurately to the hour. I just realised looking through the attendance, we've got our chairman, Michael Dixon's here, which is a great honour. Thank you so much, Michael, for turning up and being here, and for all you do for the college. Just wonderful that we've got this great resource for all of us. Something I'd like to just mention, feedback. The first 2 sessions we sent feedback forms out, and we've had some really helpful feedback come back in. So thank you for those of you who have sent the feedback. Really like it if you all would. Really, Amanda will send you all a feedback form tomorrow, and please would you have a look at it. It helps us to know what is useful in the sessions, you know, what and why and how people have found them helpful, and also we're learning how to use the technology. So we've had some advice around that, and also some potential future topics that we can talk about have come up. So you know, please, when you get your thank you those who have filled the feedback forms in up till now, and please, when you get them, please just spend a few minutes feeding back to us. So that's the way we learn. And the next session we've got planned 1st of April. We're slightly out of phase because it was the social prescribing conference last week. So the next one, 1st of April, Thursday. So 3 weeks time, I think, approximately. Anyway, and it's about sleep. So if you're very lucky, you'll have Freddie playing a lullaby. So yeah. Please let's have you all.
I'll learn another song for you. Don't worry.
Yeah. And so there we are. I think that's got to draw a line under it there. I think. But thank you all for attending, and yeah, please let us have feedback.
Yeah, thanks everybody. Sorry about the singing. You know, if you're really good, I won't do it again.
Yeah, we want it. Lullaby. Practice a lullaby, Freddie.
Okay, it was great. Great to see you all, and thanks for joining us. It's really good.
Thanks, Freddie.
Thank you, Freddie.
All right, my pleasure.
Thanks everybody.
Everyone.
Great.
See you next month.
Thanks very much, everyone. That was a great session.
Thank you.
Okay. Thank you, Michael and John. Lovely to see you.
And you.
Nice to see you, Mike. Nice to see you, Michael.
Good to see you, Freddie. Thank you. Brilliant session.
Very
Brilliant.
nice. Thank you.
Freddie, you've got a guitar. Use the guitar.
I might just play you out.
He does. Yeah, there we are. Yeah.
Give you a little tune while we're going out. Right?
That'll help people to sign off.
Don't have to hang around for it.
Oh, hanging around. First live music we've had for a long time.
That doesn't usually come over well on Zoom.
I do like to end with a bit of a dance.
Yes, how about singing as well?
Good night, everybody.
Well done. Thank you, Freddie.
Good night, Freddie.
Thank you, Debbie.
Thank you.
Thank you. Lovely.
Thank you.
Bye.
See you next month.
Bye.
Lovely, wonderful.
Bye.
Thank you. Bye.
Bye.